Welcome to Divorced in Utah. I'm your host, Paula Whitaker, and today I'm here with Eric Ichimatsu. Okay, I got it. I was going to have him do it, but I did it, so that kudos to me. And Eric is a really good resource if you need health insurance. So that's kind of your specialty, right?
Yes.
So tell everyone like what you do and how you can help. Well, what you do, what you can help them with.
Yeah, of course. So I'm with U.S. Health Advisors. We are specifically helping those who need an individual plan. So those who do not get health insurance through their company, through their employer-sponsored plan, and who are confused and concerned as to where and how to get the right health insurance plan for them. There's a lot of confusion, the Affordable Care Act in the marketplace with healthcare.gov, the different plans that are available on there and how to estimate maybe your income, whether you're going to be able to get a subsidy through the government, or if you'd be better to go maybe through a private marketplace plan where they do medically underwritten plans or some other plans that might be a little bit less expensive, have different coverage, maybe have some extra supplemental coverages as well. If you're worried about cancer running in your family, or you have a very active lifestyle and you might injure yourself, whether through hiking, biking, or maybe you're just very clumsy. So there's a lot of different parts that go into health insurance, and it's just a matter of each person's individual situation to find out what the best plan is for them. And the best part is that all of our services are free. So the insurance companies that we work with actually pay us money to help people to find the right plan as part of just how it all works.
So I like that. That's very, very helpful. So I'm thinking a lot of my listeners they've been married and then they're getting a divorce and they haven't been at a company where there was insurance. Mm-hmm. And so now it could be, the woman or the man needs to find insurance for just themselves. I think most of them it's just themselves. Mm-hmm. And maybe they didn't go to the doctor. So what scares me is these huge deductibles. So I look at the insurance, health insurance options, and I'm like, well, if it's, a $10,000 deductible before they'll do anything, then why would I guess you need insurance in case something catastrophic happens, but what, I know there's a lot of ranges. So if I go to the doctor once a year to get my physical, I need to go to the dentist, trying to think, I'm not going to get pregnant, and it's just, that's all I need. Mm-hmm. How much average a month do you think that I will have to spend? And I know this ranges on deductible, but let's say I wanted something that was a low deductible and that's all I needed my insurance for, maybe some prescriptions.
Yeah, of course. So with the public marketplace or Obamacare, you're going to find that the lowest deductible that you can get is $1,500 per person. With a family deductible, if maybe you are insuring your children as well, of $3,000.
That's the lowest? Mm-hmm. Okay.
Unless you're getting a cost share reduction, which is depending on your income if you can qualify for that.
Right. And I'll tell you, I went online to do that, and the process was, I want to say mind-numbing, but I was so confused. And you know what? I used to work for Pacific Care back when it was, HMO, PPOs before these deductibles, these huge deductibles. And I was confused. I thought, okay, because there were so many different options. And I think I would have loved someone like you, because I could say, this is what I need. Mm-hmm. I need prescriptions. Maybe I go to the chiropractor, and I just want to go to the doctor once a year, and I might need a flu shot, right? Yeah. So, and then you would be able to help me and go, okay, let's look at this. If you qualify for this or don't, here's where we'll start. Mm-hmm. Is that right?
Yeah.
And I could just call you and you'd come to my home, or do you just...
Yeah, so I have an office. I have one in Orem and in Woods Cross that I can meet with people in. I'm also mobile. I come to your home. I'll come to your office, or we can, with technology today, we can just do a video call or a phone call with a screen share, and I can go over everything and show you all your options.
Okay, no, that sounds really good because it's so confusing. It really is to me. I believe that's like the number one most difficult thing after a divorce. If you don't have the insurance, where do you even start? And that would be really helpful to have you as a resource. So what else do you see any other things that maybe come up that they would need to know about or prepare? So if you qualify, so that you would need your tax returns and stuff like that to know if you qualify for the government aid, right?
Yeah.
Or help. And then anything else that people ask you?
Yeah, of course. So, when you're going through the whole process of a divorce, there's a lot of emotions going on. It's really a tough time, and oftentimes health insurance is probably going to be something that comes as an afterthought, if anything. So if you are losing your health insurance because of a divorce, whether your spouse had an employer-sponsored plan or they had a private marketplace plan, but because now that you're separated, that will end. What will happen is you will actually get a letter from either the HR of your spouse's work or from the health insurance company saying that you will be dropped, and it'll give you a date as well. It's usually going to be the end of the month that the divorce is finalized.
Oh, okay.
And that letter is crucial. You do need that if you're going to sign up for an open enrollment or special enrollment through the marketplace. You do need to upload that letter to show them or give them proof that you did lose insurance or you're going to lose insurance. And you only have 60 days after you lose coverage to sign up. If you wait longer than the 60 days, then you're out of luck for those particular plans. Now, the Trump administration is kind of changing some things with, the health insurance marketplace. So you might be able to qualify for a medically underwritten plan. So those ones do depend upon your health, but generally, like you said, if you're going once a year to the doctor, maybe a chiropractic, maybe,
some prescriptions.
Yeah, once or twice, things like that. And that might be a really awesome option for you because you can actually get zero deductible plans on the private marketplace. Zero deductible, low out-of-pocket maximums, great coverage, and usually, depending on what your income level is, it will be less expensive than the full place marketplace plans. So if you don't get those tax subsidies, you can save usually 30 to 50% on your premiums by going with a medically underwritten plan.
Wow. Okay, you guys, this is all news to me. I had no idea about this.
There's a lot of new
stuff.
stuff.
That's great. I know, and it changes all the time, and it's driving me crazy. So I love that I was able to interview you, that I'm able to have you and teach us. So, okay, what was my question? You were talking about, so what do I need to budget? So this is the thing. When you're going through a divorce, you need to budget for things, and then you start going, okay, this is what, I'm going to need, or, I need to pay. What should they budget for insurance? Like what like $500 a month?
Good question. So, and it's just difficult, right? Because it ranges so much. So, if you're super young, if you're in your 20s, let's kind of back up a little bit.
Okay.
So with the tax subsidies with the federal government, these are very loose numbers. Don't hold me to it. This isn't exactly compliant.
Right. I kind of put them on the spot, you guys.
Yeah.
So.
But if you're an individual and it's called modified adjusted gross income, which is basically just your adjusted gross income. So your gross income minus, maybe contributions to a retirement account, a couple of other things. If that is above $45,000 a year, then you're not going to receive any sort of tax subsidy from the government.
Okay.
If it's under, then you will.
Okay.
Well, if it's maybe you and you have one child, you're looking around 60 to 70,000 is going to be that cutoff. And then if you keep adding children on top of that, then it can go up to about 125,000. You can still get a tax subsidy if you have, say 5 or 6 children, you
Okay.
can still get that tax subsidy even if your income's higher.
So that all depends there.
Yeah.
So let's just say
Mhm.
you don't have to cover the children
Yeah.
and you're 35 years old.
Okay. Yep. So if you're going with the public marketplace and you receive a subsidy, you can get it $0 to maybe $100 a month.
Mhm.
If you don't receive a subsidy, you're probably looking at $300 to $500 a month with
Okay.
a high deductible plan. In the marketplace, the private marketplace with the medically underwritten plans,
Mhm.
you're probably looking at probably right around 200, maybe 225
Okay.
for a 35-year-old.
So I think budgeting 500 a month would be safe for a 35-year-old,
Okay.
just to be on the safe side.
Yeah, you'd be fine if you had to pay full price in the public marketplace, or if you're going private or anything like that.
Okay. No, that helps. That helps because you don't know you have no idea what to budget, and then you
Yeah.
don't know what to negotiate, in the divorce. So,
And what I would say is, if you need a resource, I'm very responsive. Text, call, email, just
he is
a
very
Facebook.
responsive.
All I need is a zip code and then an age, and I can get you quotes within probably 5 minutes.
So a zip code, age, and then if it's just you
Yeah.
or how many people you need coverage
Yeah.
for.
So I'd need ages and genders of everyone who would need to
Okay.
be on the plan.
Okay, no, that's great. Okay, so again, so that is amazing. So I will give your contact info at the end.
Okay.
You also